so many different. All right. Okay. So, just to start with, the simplicity in keep simplicity. So keep things very, very simple. Don't take it very, very complicated. Don't go into over interpretation. The more simplistic approach you take, the better understanding you will have in finding the children's remedy. Child's discomfort is often seen as interpersonal relationship level. You will be able to observe it much better with the person who's bringing you the couple who comes to you with the child. The child's discomfort will be reflected in their relationship, so you have to observe that. Emotions like jealousy, embarrassment, domination, and disappointment, they're important clues, but in the polished world, they will not be readily available. Okay, so you will have to identify, dig it out. And clinical impressions help in understanding and solving a pediatric case. So even before you go to your psychiatric understanding, or your psychological interpretation or psychodynamics, first and foremost, define what you're treating. So clinical impressions is a must. So many times children will come with stomach ache or headache, or some very, very silly kind of complaints, and they will be nagging complaints. So I'll tell you, there was many, many years ago, there was a child who came to me with stomach ache. Okay. And the father said that natak karta hai. The child is just making dramas. He does not have stomach ache. But the mother was very wise. She said, I believe my child, and I'm very sure there is something wrong with him. So they had gone to multiple allopaths and multiple homeopaths. Everybody had dismissed it because father's approach was itself very dismissive, right? But when I examined him, and clinically, so typically in the right iliac fossa, if you press and then suddenly release, and then if the child grimaces, okay, it's not a pain, it's just a grimace. That much is good enough to for you to diagnose subacute appendicitis. And that's what I diagnosed for that child. Then we did get USG and other investigations done, and he did have subacute appendicitis. So his stomach ache was not because of his dramas or his avoidance to go to school. So had I not done that, I would have also gone with other physicians who were dismissing the child's condition. So clinical impression, clinical evaluation, your own complete examination of the child is a must. And in children, you cannot ever not do investigation. So you have to do the clinical examination properly and come to a conclusion of diagnosis, clinical diagnosis first, and then you go to interpretations. Okay. Now, what are the essentials? So the components which are needed for, you will look at the patient, but you also will have to look at the parents like the whole kind of dynamics which is there between the parents. That will be very, very essential. And then obviously homeopath is important because we are going to be the bridge between these two. What is the child's inner world comprises of? Usually it is the bigger chunk is always mother, then comes the father, then the society. So you need to have these three components. Absolutely, you need to inquire them into every small, tiny bit. How much time the father, like what are the father's working hours? How much time does he spend with the child? What is mother doing? When she is at home, what is her favorite pastime? Simple things like that. So mother may say, कुछ नहीं reel scroll करती हूँ. Like I'm just scrolling the reels. Dr. Halovini, Hindi, little bit of, I can speak, right? Yeah, okay, fantastic. So if she just says that kuch nahi thoda reel scroll karti hu, that means she is spending a lot of time on her gadget. So you need to understand what the child is lacking. Okay, you need to ask them whether the child is friendly in his building, whether he goes out, how does he react. So you will know all the reactions of that child without actually asking him, isko dar lagta hai kya? इसको गुस्सा आता है क्या? You don't have to ask these kind of things. So these are three components which are a must, which you need to ask. Don't ask कि जल्दी दोस्ती बना लेता है क्या? Don't ask him that. Ask him, does he like to go down? Does he like to play? Does he like to go to your neighbor? What does he do? Then these are more open-ended questions. Okay. So let's start with the case. So this was an 8-year-old female child, and she had white discolorations. So there were various white discoloration spots over last 2 years, and gradually it was increasing. She also had asthma since 5 years of age. Okay. And there were, when on examination, there were rhonchi in the basal lobe, and there was no cough at all. Okay. She was absolutely normal, but she did have rhonchi. Neither her respiration was also not shallow. So you have to understand the gravity of the situation. And this also gives a certain clue to the personality of the child. She was generally so, usually her mother accompanied her. She said she's a very happy child. She's independent. She does not need my help. She's sociable. She has 4 friends. She loves dressing up. And mother says that every day when I get ready for my office, she comes and tells me, Mama, you're looking very nice. And she loves jewelry, makeup, clothes, plays with dolls for hours. She said, this child does not bother me at all. And she painted a very happy picture of this child. So I naturally, very simple case, I thought Calcarea Phos 200 BD for, 2 days, and the regular, your R2 pills were given for a month. Now 1 month, 2 months, 3 months, no change. But mother comes monthly for her treatment. She says, this is how she is. I take her to many doctors. She's no change. That she doesn't improve. And the mother was quite strict. 4th month, father comes with the child. And every time before this, the child, when she's come, she's sitting very coyly, very quietly, smiley face, no complaints. Whatever the mother says, she says, okay, yes, that's it. Okay. So I thought she's little shy, but a lovable child. That was my impression. And I was continuing with Calcarea Phos, but it was not giving any change. And fortunately for me, father came with the patient. And there was a completely different child which I saw. There was a very unique chemistry. Both of them were like nicely talking and interactive and all that. Mother was tall and very assertive, kind of an aura, corporate kind of a look she had. Father was very thin and he was shorter than mother. And he was quiet, just like how this girl was. Okay. And then I started talking to the father and I took a complete review from him. And the patient, she was in such a happy space with father. They both were talking to each other. Even she was correcting, no, Papa, this is what has happened, and this is how things are. And they were like, I have never seen this child talking like this. And then we got to know that mother dominates father in all the areas. Then I asked the child to step out and I spoke to the father for a while. And then father tells me that the patient is always looking for mother's approval, appreciation, and mother does not care about this child so much. It was an unwanted pregnancy because the older child is 14 years older than this girl, and it was an accidental, unwanted pregnancy. Mother initially said, I want to discontinue, I don't want to continue with it, but father wanted a daughter. And he said, it is God's signal for us. So let's continue. And that's how she continued. She did not argue. And she did not even she took rest only for 40 days. And from 41st day, father has been looking after this child. He changed his job. He took it in such a way so that he can look after her more. And the whole dynamics, the whole expression of the case changed after that. Then I understood that how the mother has rejected her right from birth, like right from conception. And this is that um, the delusion that she's been forsaken or deserted. And that's why miliary vitiligo. So the kind of vitiligo which was there, which is also muted. You understand, it does not give a very clear expression. It is not giving a clear patch, but it is a muted vitiligo, miliary, like many, many small spots, which you cannot even identify. And she's a Tamilian girl. So the skin tone is also such that you cannot identify it very, very quickly. Then she had ailments so we took this ailments from neglected. She was a playful child, self-sufficient child, and she was always looking after other people's need. And she was very sensitive to rudeness. So anytime mom raises her voice, she would get fever or asthma attack or something like that. And she was a very quiet kind of a person. And when you put it in repertory, obviously magnesium comes. I had given her calcarea pause. It did not give any result. But when we started magnesium carb, the theme was feeling of being rejected and the feeling of being neglected. Effectively, we gave magnesium carb. So, as expected, you can see the first picture is where you can see a lot of spots are there. And this is the picture after 2 months of treatment. So, very effectively, and her asthma completely vanished. So, this query, the question that maybe my mother loves me, that was the dynamics, which I had missed absolutely if I would have not incorporated father's perspective. So, this brings me to the first point that no case of a child has to be defined with single parent. This was long time ago. So this is probably 2015 ka case hai. So I have grown as an individual, and that's what I'm sharing today. That had I taken into account both the parents at one go, then I would not have missed magnesium carb in the first time itself, and I would not have lost 3 months. So the first takeaway is always ensure that you invite both the parents for your case taking, and you take individually. Do not take it together. You can take it together as a family first go. Then you ask the patient to leave, one of the spouse to leave, and just talk to one person. Then you call the other one, just talk to that person, and then you ask both the parents to leave and talk to the child, no matter what age it is. Even a 2-year-old, 3-year-old child, if he can stay all by himself, you talk to him individually. You ask him what bothers you, whatever the presenting complaint is. Ask him, तुमको क्या तकलीफ है इससे? मम्मी पापा बोल रहे ठीक है, तुमको क्या तकलीफ है? And you will get a unique perspective in every case. So that was my first. Get both the parents. Okay. We'll move to the next case. So this was a very interesting case. And this case, I had put it in this PPT long time ago. So I actually had to go back and read the case paper today when I was presenting. So this case is from 2010. So 10-year-old female, she had asthma since the age of 6 months. So many treatments were done, and when she had come to me, she had carried a huge set of medication with her, that these many medicines are going on. And plus, whenever the child was asked to go to any trip or any picnic or any place like that, she used to carry nebulizer with her. And she was so scared of the asthma attacks that she said, I want to keep one nebulizer in the nurse's room in school. And she had given an application to the school that please allow me to keep my nebulizer in the school so that whenever I have an attack, I can take a nebulization. So every day pumps, three, 4 time pumps, every night nebulizer. That was the kind of story this girl had come with. And the peak flow meter, I don't know, do you guys have peak flow meter in your clinics. So if you don't have, then definitely this is a good investment to have a peak flow meter. You must for every follow-up, because it's a demonstrable follow-up, that every time the child comes, you ask him to blow into the peak flow meter, and you can have a recording, and you can have a very evidence-based follow-up, that whether your remedy is acting or not. It is good for you as well. Okay. So the peak flow meter, and there are those mouthpieces which you get extra with it, which can be removed and thrown. So her first reading was 130, which was super low. She had so many times experienced dehydration because of asthma, that she had developed black discoloration around eyes, and she was a beautiful girl. Imagine having black discoloration around the eyes at the age of 10. So very, very obedient, very quiet kind of a child. And she had her organized planner and everything she would have for her studies, but she had super anxiety. So in spite of studying, the anxiety was so high that she could not bear the thought of exams. Every exam would bring her to severe attacks of asthma. In fact, so many times she has come to my clinic with asthma attacks, and she would say, give me something so that I can go and write the exam today. And most of her exams she has given in the principal's cabin. She could not even climb because of the asthma attacks. Okay. So she had severe sweating of palms and consensuous kind of a child. So, very quiet, very sweet, very obedient, very image conscious. I had given Calcarea silicata. It did not help. There was, so momentarily she was better, and I used a lot of acutes. A lot of acute remedies were given in 6 months. First time father came for his, eventually, um, so all their acutes, they were getting better without hospitalization. For the family, they were doing very good. They said, we have never seen this kind of a result," but it was not a good result for me. Okay. But the family was impressed, and the father came for his treatment of vitiligo. Now, the father is a completely type A personality, go getter kind of, very, very competitive, very pushy. And he wanted daughter to go into aviation study and engineering, and an international institute only she had to go. So at the age of 5 or 6, these kind of talks were there in the family. And you imagine the child is already anxious, and the father is telling at that age that you have to go and study in an X Institute of France, which is absolutely big in aviation, and you must do only this. He himself was like that kind of an achiever. So wherever he goes, first thing what he does is he buys a flat, and of a premium property he will buy, whether he has that kind of resources or not. But he says, if I don't create that kind of a pressure for me, I don't work. And therefore, he put the same pressure on his children, that you have to do a certain thing, you have to go a certain place, you have to do a certain thing. And the girl completely idolized him. So it's a very nice family, very cohesive, very nice. But the pressure inside was building because there were so many demands. Okay. And when I understood this, then the evaluation started, that it was a meticulous, planned, and solid structure wala child. So definitely a mineral kingdom. She needed confidence. She needed approval. There was anxiety. She couldn't decide for herself. Therefore, row 3. And then the confusion of mind and indecisiveness, uncertainty, anxiety, that brought me to row 3, column 3, alumina. And, I was giving her calcarea, which was row 4, which requires more safety, more kind of a, dependence. That was not the need of this child. The child needed more decisions. She needed more certainty. She needed more assurance, which is more of a row 3 issue. So when I gave her alumina, she improved, like, absolutely. The asthma pump, the frequency dropped to 0. Nebulization, she initially few days she did it for once a day, and then eventually once a week, once a month, and like this she completely improved. So there were some few symptoms which I had taken. um just give me okay. So the symptoms which were very, very important was she would have anxiety in the morning. First thing in the morning, she would wake up with anxiety. And there's only one remedy for that rubric. That was alumina. Concentration difficult, want of self. So there were so many symptoms which were taken, which definitely gave us alumina. As so from the thematic understanding also alumina was fitting, and from repertorization also alumina was fitting. Okay, so alumina 200 was given, PD for 2 days and followed by CR30. Then she gave exams without inhaler, and that was, I felt, as one of the biggest achievement. We required very few acutes, and from the age of 10 till the time 12 till 12th standard, she did go to France, by the way. She's 22-year-old girl right now, and she is in France, and she has studied aviation engineering and all those things. She did do it, but alumina supported her structure. The instability which was getting created because of the push, alumina helped her till 12th standard. I've treated her, and after that she's not required medication. So her asthma completely recovered in 1 year. After that she did came for PCOS or whatever other puberty related issues, and she did take counseling before leaving from India, and all of those modalities helped her. Okay, now this is one of the case. So I'm going to stop share for a few minutes. Okay, and all right. So I'm going to ask you, the child came, so you've seen the picture, right? The child came with weeping eczema. And I was actually on vacation. This mother had called me, and she said that the child, we have already given graphitis to her. See, the family is kind of a homeo enthusiast, and they have already gone to some big names in Mumbai. So I'll tell you where I practice. There are a lot of big names surrounding me in 10 kilometers diameter. So they, whenever patients come to me, they've already gone to some other homeopath. It's not the first time. Okay. So what would you give to such a patient who is coming and telling you, now this is happening on phone, she's saying there is a weeping eczema, the child is absolutely cranky about it, he's very, very hyperactive, and we have given graphitis, it is not working. What would you give, or what would you ask? Come on guys, quickly.
It will
How about
mask the symptoms,
Hmm.
right? Graphitis would have masked the symptoms. So I would give SL so that I get the clear picture.
Okay, they have waited for this eczema is going on, and this is a 6-month-old child. You have to
Mm.
understand. Okay, so the child is in trouble, and they have given graphitis last week.
Mm.
This condition is going on for last whole month.
Mm.
What would you ask? Anybody? No? All right. So I'll tell you what I did. What I did is I asked them, what is the child's activity like?
Mm.
Okay. What is the child doing? So she's saying, no, he just rubs the ear with his knuckles. So she said, I'm putting him mittens, the without finger wale jo mittens aate for kids. She's saying, I'm putting him those compulsorily because, and I tie it very tightly so that he's not able to remove. So nails are not hurting him, but he rubs the ear, but he is very active. He's taking the whole house down. He's started crawling, and he's extremely hyperactive child. Okay. So, and I was on a vacation. I did not have my repertory or anything. And this is a very old case. Okay. So I say, oh, all right. what are his cravings? Have you started top feed? So the mother did not have so much milk, so they've already started top feed, and the child is crawling everywhere. So 6 or 8 month old child. This was because the child was moving around in the house. Okay,
Mm.
so he said he enjoys sweets. So only two symptoms I took: skin affection and a hyperactive child who's enjoying sweets. Just
Mm.
two symptoms, just top of my head. I said, give him sulfur. They had
Mm.
medicines at home. Sulfur 30 was available. They gave sulfur 30 TDS for 3 days. By the time I reached Mumbai, she came to my clinic showing me that ear is completely clean. So,
Mm.
so many times, just because of the hyperactivity, that
Mm.
was the hallmark. So it's not just skin, and it can be very, very simple and easy. As I mentioned, simplicity has to be there in the prescription. So this was the most simple prescription I've ever done in my life. And very beautiful result. You see, month-long eczema, weeping eczema is going away in just 3 days. Completely clean. So that was another thing, that do not go and think too much abstract, and do not worry if somebody's best selected remedy has failed. Your remedy will work because your thinking is sound. Okay.
Mm.
Now coming to the next case, this was a very, very okay. So this is a precious baby. Okay, this is a 3 year old male child. He's taken birth after 5 failed IVFs, and the father, in spite of so many IVFs, father is least bothered about the child. Father does not care so much about him. Father treats him just like an extra furniture, and mother is the sole care provider. She's a working mother. The child is in daycare for since the age of 3 months. They do not have anybody to look after, and the family's condition is such that both the parents have to work. They cannot, one of them cannot stay home. The child does not have any interaction. He doesn't speak. What he does is only screams and shouts. He's extremely hyperactive. He does not even make eye contact with the mother. So very, very unsocial kind of a child. The school teacher does not know whether he understands anything or not. So his comprehension is not understood. He occasionally sits in the class. He's generally moving around and he's teasing other kids. Anybody touch him, so no one can touch him when he's angry. Okay. So all these symptoms, the abruptness, his absent-mindedness, hyperactivity, everything I'd put together. And when you repertorize, you get tarantula. Yeah. When we gave him tarantula, uh, nothing much happened actually. Okay. And it's a very big, big case because th- there were continuous 2, 3 rounds of history of the mother was taken. By the time the IVFs were failing, mother and father had kind of grown apart because, so many failures when a couple experiences, they generally, so one person's capacity to take failure will define how the relationship will turn out to be. So if one
Mm.
of them is not comfortable with that kind of a failure, then he moves aside. So the father has become completely a loner. He has
Mm.
stopped interacting with his friends. He has stopped interacting with work people. So he just goes to the office, works because earning money is essential for this family. Therefore, he's working. That's it. He has become like a complete different person. He's gone into his shell. And mother, by the time, so when the fourth IVF they got success, she said, we didn't even celebrate this. So this is a precious baby, most wanted, but when they got it, almost they didn't want it. So that is the kind of state. Okay. And you see, spiders, if you
Mm.
look at the spider web, you like it. It's a
Mm.
beautiful thing when you look at it in a jungle. But if that spider web comes in your house, you don't want it. You want to just swat at it and you want to remove the spider. That's the kind of story this child was experiencing. And that was the kind of inner world which the child was experiencing. There was a neglect of a different kind, wherein they wanted it so much, but now they don't want it. So from 3 months of age, he's been neglected, he's been put away, he's just been maintained. That is the kind of feeling. And therefore, we have not given him tarantula. So Tarantula hispania was given initially. Later on, he was given Arania diadema, which is like a superlative neglect and hyperactive reaction. And that helped beautifully when you understand this whole dynamics that, you do not want something which you wanted so badly. So that is the kind of dynamics which Arania diadema has. So even if we reach to a spider, we have to go to a finer differentiation. So that's what this case is about. Okay. Now we'll go to the next. Iska heading galat ho gaya hai, but this is the next case which we are going at. Dr. Halvani, this space is good because I want to cover a lot of cases and what actually you receive in a case. How much
Yes,
time do
doctor.
we have?
Dr. Sankari, are you keeping time?
Yes, ma'am.
Yeah.
We are having around for it to reach 9 p.m. We have 15 minutes, but the session is good, ma'am. Depending upon the
Okay.
audience reaction, we can proceed further.
Yeah,
All
go
right.
on, doctor.
All
Good,
right.
good
All right.
quality cases. We are interested in cases. Thank you, doctor.
So, my point of sharing these cases is anybody can reach a remedy. That's not the point. Okay. Because today, if you take all the symptoms and put it in ChatGPT, it will give you the remedy. So that's not what I'm more worried at. You need to have an idea as to what to look for in the case. And therefore, the title of the talk today is Case Receiving. What do you receive in a case? What do you pick up? Because if you understand that, finding out remedy is just a cakewalk. So I'm not focusing too much on remedy differentiation and all that, but what you receive in a child, that's what. And this next case is another one of my most favorite cases because this is also a case of a 8-year-old girl. Okay, she came with huge bulle, so pustule, and then something very large, bigger than the pustule is a bulle. Okay, it is filled with pus pulsating, and this child had. So the parents were not ready to accept that their child had type 2 diabetes at the age of 8. We did a lot of investigations and I ruled out type 1 diabetes. Then we came to type 2 diabetes diagnosis. She had so many pustules and bullae in the folds of the skin, in groin area, and they were stinging, throbbing pain they had, but the child was not a complaining child. So she would bear the pain and she would just do like this whenever the clothes would touch her. That is the kind of sensitivity the child has. Okay. She had developed in past 2 years, she had gained a lot of weight. She also presented with headache, dull headache, and almost every day she was having. She would weep silently whenever she would have headache, but she would not complain. She's an absolutely non-complaining child. Now, she also had respiratory complaints like, recurrent cold and cough, allergic rhinitis is what she had. So, all right, my titles are little screwed, don't worry. But, we are talking about patient as a person. She had a craving for very rich food. So cheese, potatoes, rice, sweets, sugar, ice creams, and aversion, nothing specific. She loved food overall. She would sweat very profusely, and injuries always healed with suppuration. So that was one of the most hallmark. She's a chilly patient and the weight was 48 kgs. She was a short child, 3.5 feet probably, but 48 kgs. She was like really fat, like very stocky built and round faced person. Now she was a single child, very pampered, very protected, and both the parents were amazing. Both of them had love marriage, a Marwadi Agarwal lady marrying a Gujarati Jain, and very cohesive family, very, very nice dynamics. Both the parents are superhumans, like they're very nice people. So they were never scolding her. They were not at all very harsh, or there was no reproach at all to the child. Okay. Even then, in spite of that, she was very sensitive, and she would ask mother, she would keep on. So, mother had only this complaint that she apologizes too much. She will come and say, sorry, mama, aisa ho gaya. Sorry, mama, this happened. Sorry, mama, sorry, mama, sorry, mama. She's like, she's so particular. She's nice. She does all her homework, everything. Very obedient child. But she does not like to change her routine, even on holidays. So if in school days she wakes up at 6 o'clock, Saturday, Sunday also she will wake up 6 o'clock. But she's lethargic. She doesn't want to go down and play, and she's disinterested. She was more interested in art and all. And then there was boredom. She did have that. Now, mother's state was okay. She did have like extreme anxiety. So by accident, if something breaks, she will apologize so much, and she will get scared, and she'll start crying, and all that. She would say, sorry, 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 I should not have done that, this, that. Like, even if mother said it's okay, you can break things, this is your house, but she will tremble, and she will have all the apologetic behavior. He had lot of fears: fear of dark, fear of being alone, fear of the teacher scolding somebody else in the class. She will get scared, and she will start apologizing. But homework she does immediately as soon as she comes back from school, but other things she can procrastinate. Okay. So if at all mother sometimes says something that, why you're not getting up, why you're not going down, she'll say, please, please don't leave me, mama, don't leave me, mama. She don't abandon me. That was her feeling. Okay. So she loves to read, very sweet child, short, overweight. We've already spoken about it. Now, the mother's mental state during pregnancy is again, the patient is born with fifth pregnancy IVF, 4 IVF failed, fifth IVF successful. Okay. And the entire pregnancy duration, because the mother has taken so many injections, she developed glomerulonephritis, and she was bedridden. And it was a very high risk pregnancy. So mother was always anxious. She would have lot of fear, and she had all those nightmares and frightful things. Whatever the child experiences today, all those symptoms mother would experience only during her pregnancy. Mother is generally a very bold person, so she did not have otherwise fears, but she experienced that. And mother had developed sleep talking only during pregnancy. Later, she did not have. Okay. Now, even when the child was born, for first 3 years, because severe glomerulonephritis, mother was bedridden. So, along with other health status, mother-in-law issues, and there were some of the other things which were there. So, mother had insecurity in the first 3 years. So, duration of pregnancy, insecurity with regards to her own health, with regards to whether the child will survive or not, because there are so many failed IVF. So there was so much anxiety which the mother had experienced, and we can see all of that anxiety completely transferred to this child. Okay. So play aversion to, there were some symptoms. So my regular modus operandi in any case is, when the child is, or when the patient is describing symptoms, I will directly put it in a repertory, and I will take it. So there is no order of repertorization which I follow. I simply take all the symptoms, different boards I will keep on creating, and whatever comes up, then we will evaluate. Okay. So as it is, what my whole motive is, you take symptoms as they are coming without adding your own color. So all these symptoms which are not requiring any interpretations, I had just taken that. So mind play aversion to, reading desire for, loquacity. She was talking a lot. She used to talk a lot. You have to really ask her to stop. That is a kind of talkative child. Company desire for, fear alone, fear children in, fear of dark, fear of failure, postponing everything to the next day, confidence want of, anxiety conscience of, responsibility too strong. You see, when you take all these symptoms, what comes is Kilcaria, carcinosin, Lycopodium pulsatilla. So then we took all the other symptoms like sweets desire for, sugar desire for, cream, cheese, milk, potatoes, perspiration profuse, skin eruptions, vesicles large, again calcaria. Then we took mother's mental state during pregnancy. So a separate board exclusively of mother's mental state. Okay. So my mind, night aggravation, she could not sleep. Activity, passivity, activity. So because she was mentally very active, but she was passive. Like she had to undergo bed rest. Absent-mindedness, anxiety with fear, anxiety with perspiration. Again, in that also, Calcaria was coming up, and we did take her dreams and all those things. So effectively, this is a 2018 ka case. We have given her Calcaria Carb 200 and follow up within just 2 weeks. So this is 14-8. The first follow up is 28-8. When the bullae had subsided completely, no new lesions, the child became active. She started taking interest in physical education in school. So this was one of the teacher herself has said ki this time she herself said that I want, because in the PT class, what she would do was she would sit in the class reading her book, but she now started going down to do the physical activity. After a month, one pustule was there, but other things have subsided. She started going for a dance class. She started doing yoga, and she lost already 2.5 kgs of weight in just 1.5 month of treatment. We continued Calcaria Carb, and the best part was start of the treatment. Her HbA1c was 9.6. In 3 months, her HbA1c was 5.4. So you see, mother's mental state, because the whole idea here was to understand how did the mother experience her pregnancy. So this case is one of the most important one, because when we dealt with mother's anxiety, automatically we found a right prescription, plus we found origin of the child's fears and other things, and we dealt with mother's anxiety only. Because when she was narrating the whole pregnancy history, I could see that the mother was still experiencing that kind of intensity. So we dealt with that as well. And this is the 2 weeks follow-up. So the first, you can see the top section where the size of the pustule, and the child doesn't complain even if in spite of having such a big pustule. And just 2 weeks, the pustule has subsided completely, and you can see there is a difference in the skin tone as well. It looks little like better than the earlier. The dark discoloration also subsided. Okay, so what are the prerequisite of a physician when they are dealing with a child's case? So you have to be unprejudiced. So do not do not go with one parent telling you the story. So don't get prejudiced with that. You have to be unprejudiced. You have to be a keen observer and observe the child, observe the parents, observe the interaction, observe the silences. How both the parents, when they are interacting with the child, what are they communicating silently? Observe that. You have to be patient centric. So don't go by what the parents are saying. You have to look at the patient, and you have to be completely objective. You cannot add your color, or you cannot take their color, and be flexible. Like you see that case of magnesium. I did not stick to my own initial understanding. I am flexible. I'm changing my prescription when I understand the case better. So be flexible and do critical analysis of your own thing as well. What the parents are giving, do a critical analysis of that. What you are thinking, do a critical analysis of your own thinking. Take all the symptoms in account very, very meticulously. Take it objectively, take it as it is given without interpretation. And most importantly, be devoid of false ego. So don't say that, I have treated this case. So the other one is also going to be a cakewalk. No, even a simplest coryza can also be a challenging thing. So maintain all these prerequisites and you will be able to solve any case. So you can take a screenshot of this picture, because this is what you need to do in every possible case. Okay. Now, what are the child's environments? So generally, I have treated so many patients so far in my 25 years of experience, handling more than 33,000 people. I have understood that nuclear family dynamics is completely different, because you need to understand that the child may be raised by maids or the creche people. Parents' ideology can be different, but the child can be raised by someone else, and you need to take that person also in account. Parents may miss observing the child's behavior and the changes during illness. So if you have to ask them, does the child have a caretaker? If they do have, call the caretaker inside. Ask the caretaker, what is the color of the stool? How is the thirst? What is the child doing when they has fever? Parents would not know. Child's reactions during family conflict will give you an understanding. So when the parents are talking to each other, you look at the child, how the child is reacting, whether the child is relaxed, or whenever the parents start talking, does he like become conscious, is he looking at the parents, what is happening, to understand. Behavioral responses are more important for a child's prescription than what the parents are saying verbally. Okay, so understand the behavior. Then gender biases. And people coming from different states of India, people coming from different states, different cities will have different conclusions. So male child may receive more privileges nowadays. It can be the other way also. Okay, and there can be authoritarian behavior from one of the child. So you have to understand that girls might feel suppressed or neglected. All the behaviors of all the siblings have to be evaluated. You have to understand. So, though I have written only male child, but you can see a family which has maximum male children, and suddenly a female child is born, that child will be more preferred by everyone, and there can be a completely different gender bias. So you don't know which side, but you need to keep that into account. Understand what is the family's influence as well. Observe the child in your clinic. So allow them, don't like completely ignore them. Do not give any instructions. You keep your focus on them. Okay, but do not make them feel that you're observing them. So observe them for cleanliness, dressing sense, imitation habits. What are they doing? What is their tone, gesture, whether they're doing an eye contact? The expressions are important. Where what kind of emotional state they come into? Are they scared? Are they anxious? What kind of personality? What do they do? Are they asking for permission before touching few things, or are they reckless? So I have a bookshelf in my cabin, and there is this one child, 1.5 year old. Whenever she comes, what she does is she will pull all the books and she'll throw it down, and her mother just sits quietly. She doesn't tell her that don't do this, don't do that. But what she does is, mother keeps complaining, oh, she gives me so much trouble. This girl is too much. She's this, that. Arey Baba, you are not telling the child what is to be done, what is not to be done, what is acceptable, what is not acceptable, what are the boundaries. So, you understand this dynamics, that I can see when she's throwing my books, my precious books, she's just dumping it down. The mother is sitting quietly, so you understand the dynamic. So observation in clinic is of utmost importance. The parenting styles and its impact. Overprotective parents weaken the child's confidence because of overprotection. What they do is overcorrection, and they will be completely demolishing the child's confidence. Dominating parents will impose excessive activities. So, tiger moms, they will take the child from one place to the other, to the other, to the other, and then you'll understand the child is not interested in really doing anything. Okay. The child completely loses track of what he's doing. He just simply goes to the activities. He doesn't excel in anything. So you have to understand the dynamics. You ask them when you ask the mother what your hobbies are, you can also ask them, what is it that you wanted to do as a child? And then you ask what the child is doing, and you might see that they're doing that thing. So you have to understand the environment's effect. So natural emotional growth, how is it happening? Follow up of a child, you assess the energy, you assess his mood, appetite, overall well being. So, first, when we give any remedy, the discomfort has to reduce. And then you will understand this is a correct prescription. Temporary symptom changes, they have to be properly interpreted. So, you have to have your own follow up criteria made the time the child comes to you for the first time. First case definition, you have to have a follow up criteria, and it is individualistic for every case. So, prepare child-centric follow-up criteria. Okay. So this is about asthma. Because we've taken one case of asthma, I've added just one thing, that check wheezing intensity before and after. Cough may temporarily increase while wheezing reduces, and clinical judgment is of more important than parental anxiety. So that's why I said peak flow meter. If nobody, like anybody does not have peak flow meter, just simply go and buy it. It is essential. Because we've taken asthma, I've given specifics for asthma follow-up. Okay. Clinically, do not rely entirely on mother's prescription. Observe the child directly and naturally. Homeopathy is an art. Guidelines must be applied flexibly. So don't go just by what has been given. Okay. So artistic use, creative use of your intellect is needed in pediatric cases. Okay. This is one small thing. So I'm starting a e-learning course exclusively for ADHD because my thesis for my PG homeopathy was ADHD, and I want to share whatever I have learned. Okay, so this is a QR code. You can scan and fill up the Google form. Once you fill it up, our team will contact you. We are starting the course in first Thursday of March. It's a 10-hour learning course, and a lot of material will be shared in this course. Dr. Halovini will share the detail in the group as well if you want. Okay?
Yeah, sure.
Yeah. Yeah. So now I want to give you last thing, like the concisely, what do you require to treat cases in pediatrics? So you have to be unprejudiced observer. You have to be confident of the system and of self. You need to develop skill set. What skill set do you require? Diagnostic skills. So clinical diagnosis has to be sound and person understanding. So in clinical diagnosis also, I will say clinical examination is a must. So design your own routine examination set. So, like how play artist, they have their own set designed. Similarly, you write it down. No matter what the patient comes for, these are the 10 things which I'm going to examine for every patient. Touching the patient is extremely important. You just by touching, you will alleviate their anxiety. Number one. Number two is you will identify so many PQRS just by touching the patient. So touching is extremely important. So diagnostic skill, your clinical examination is a must. Clinical diagnosis is a must. Do not depend on the diagnosis which has been given by an allopath. You create your own diagnostic criteria and form a clinical diagnosis. In person understanding, you understand the dynamics. So I've already given a lot of details as to what you need to do from the child perspective. But I'll tell you, you need to understand the mind of the person. You need to understand what the inner world is. Whatever expressions are there, where are they actually coming from? What is happening behind the picture? That you need to understand. Be an eternal learner. Whatever new development, now AI is there, incorporate. Old literature, keep reading. Technology, completely incorporate in your practice. Have softwares, have repertorization for each and every case. And definitely follow Hahnemann. Imbibe his qualities of being unprejudiced. Learn to struggle. Every case is a struggle. Don't think that I have, I'm practicing for X number of years, so it's going to be easy for me. No, don't take it like that. Think of every case as a struggle and walk the path again and again and again. Every time it is going to be a struggle. Be solution oriented. So create solutions not just because of remedy. Identify what are the blocks in the family's space and give solution to them. Find, because you are somebody whom the entire family is looking at. So when you are treating the child, don't just look at the clinical entity, look at the psychodynamics, look at the dynamics of the family and give your inputs. Give constructive inputs, do not give destructive ones. Give inputs in such a way that all the good qualities of the family comes together to help this child recover completely. And then the first aphorism will be materialized, that you attain complete cure. Because treating symptoms anybody can do, but treating the disease, finding out the reason, that is what is in reality meaning following Hahnemann is. Okay. And lastly, I would like to end with this quote, that your children are not your children. They are the sons and daughters of life's longing for itself. They came through you, but not from you. Though they are with you, yet they belong not to you. So,
Yeah.
This is the philosophy which you have to help every parent understand. Then you will become a part of a bigger picture. So, with this, I thank you all for listening to me. Write to me. I would love to know. Follow me on Instagram. You can directly message me. My number is there in the group. Whatever is there, I'm always open for feedbacks, questions, anything which you want. All right. So I'll just stop share now, and I'm open for questions.
Oh, thank you so much, ma'am, for such an enlightening session. We just got to know about various approaches in pediatric cases. It was a really wonderful session, ma'am. So, can we have the question and answer session now? Audience are requested to type their queries in chat box.
So, how many people are there from Dubai? Very few, looks like.
Yeah. This
Yeah.
is a national whole
This is
whole of
whole of,
yeah.
yeah.
So we
So
are
I'll
only
be
one
coming
chapter.
to Dubai next
Hmm.
month. So whoever is in Dubai, I would love to meet you all.
We'll all be there, doctor.
Yeah, that's so nice.
Looking
Welcome.
forward to your presentation. Yes.
Yes,
Yes.
yes, definitely. So if there are any questions, I would like to take some. Somebody had raised their hand. No questions.
But initially, a doctor has raised query, ma'am.
Yeah. Mhm.
He was asking regarding the medicine chocolate in case
Chocolate,
two.
yeah.
Yeah.
Yeah, that's a very good input. But let me tell you, this was a case from my childhood. That then I was not prescribing chocolate and such remedies. I was very, very basic homeopath. Um, it's with use of software and things like that. Now I have like so many different remedies in my knowledge. Then I did not have knowledge of chocolate. I did not think of chocolate for that case. That's an honest answer.
Nice, ma'am.
Oh, wonderful, wonderful. This is a good question. Once you get the result, you spot the medication, you stop the medication, or you go to tapering dose. What is your approach? Beautiful. All right. So, usually I do not stop the remedy once I start getting result, because most of the cases, so they come after a lot of suppression. Okay. So even if we get this much result, we cannot stop the medicine right away. If we stop it, then the relapse is going to be there. So for initial few months, I continue medicine. I've initially we used to have, we have this whole romantic concept of single dose and all those things. But Hahnemann also did not give single dose. He also gave repeated doses. And you have to always assess whether the remedy is required, whether the system is asking for the remedy. So every follow-up, when you set your follow-up criteria, as I have said, that the follow-up criteria has to be set in the first case definition session itself. So when you set that follow-up criteria, you have to go on assessing how much does the system is asking for, how much stimulation the system requires. So if the system requires stimulation, you give it. There is no harm. There will not be. So, I have not seen homeopathic like remedy proving in a patient in my 25 years of practice. If the remedy is right, it acts, it continues to act. And typically when people come after so much of suppression of the system, you have to give it repeatedly. Okay. If they completely recover, then you definitely taper it down. Then you don't go on beating the system, right? So,
So thank you, ma'am. And one doctor has asked whether you have seen any post vaccination complication cases in pediatrics, especially after COVID vaccine.
yes, yes. So, especially after COVID, we can't be specific about it that this is because of COVID vaccine, but we have seen a lot of cases because of extra vaccination. So, I have some cases and I will share that group kaleidoscope. We don't share cases in that, right, Dr. Alavini?
No, doctor. That was
No.
meant for, but it ends by 31st of January. So
Okay.
if you want, you can share thereafter
If there
from
are any
February.
other, if there is any other group, you can add me into it. I will share the before and after pictures of
Ah.
chickenpox vaccination gone wrong. So,
Ah.
chickenpox is one most, like, it's a nuisance vaccine. Most of the parents are giving it, and the allopaths are pushing it like anything. But it is absolutely not to be given. It creates a lot of confusion. I have seen a lot of children coming with chickenpox, atypical chickenpox, 6 months after giving the vaccination. And it's a very, very bad case because the allopaths are not able to diagnose chickenpox because they are already given chickenpox vaccine. So the presentation is completely horrible presentation. They can't diagnose. It's an atypical presentation. And then they keep treating the symptoms. They keep giving some random medicines. And by the time the case comes to us, it is completely spoiled. So I have seen a lot of cases of wrong vaccination. So if it is in our capacity, we should dissuade parents from giving extra vaccination. I would absolutely say that.
Yeah, doctor, we look forward to you sharing your valuable experience. Please do on the group.
I, I will
Yeah.
do that. I will do that. Any other questions? Use of biochemic or combinations?
Yeah,
Combinations I
ma'am.
don't use. Biochemics, yes, sometimes when parents are very, very anxious, we will give calcarea phos, ferrum phos. It is a feel good factor. I don't know whether it works or not, but I do give it, and people really like it. I do use local applications. So I'm a big fan of local applications in homeopathy. Psychological cases like cough or abdominal pain, which will be first remedy or reassurance in counseling. Ah, Dr. Rekha, psychological cases like cough or abdominal pain, which will be the first remedy. There will be no first remedy. I would not say anything because I don't do that kind of a practice. You have to identify why the child is having psychological cough or why the child is having psychological abdominal pain. So you become friend with the child, you understand him, you understand the family dynamics. My answer is going to be the same. Okay.
Thank you, ma'am. And another doctor has asked what to do when the first prescription, after the first prescription, when asthma is getting aggravated, how to handle further potencies of that case.
Give SL for a long period of time and re-evaluate whether what you have given is genuinely a similimum, because a genuine similimum will not give this kind of an aggravation. Okay, so probably you have created some kind of gadbad there. So you identify what have you done. Okay, so do not create suppression, do not create aggravation. Yeah.
And ma'am,
And
another doctor has asked, like, what are the necessary vaccines that has to be used, and what are the other vaccines we can neglect? Like that.
okay. So legally, we are bound to give whatever government of India has identified as a national vaccination module. Okay, so whatever are the mandatory vaccines, legally we are bound to give that as a law-abiding citizen. So you just give those vaccines which are there in the government of India thing, and whatever is extra you can skip.
What about flu vaccine, doctor?
Absolutely bullshit.
Yeah.
It
True.
should not be given. It should not be given. It is compromising immunity unnecessarily. Flu vaccine is not to be given.
True.
Ma'am,
Any
another
other
doctor has
question?
asked, like, do you recommend vaccine for your patients, for the kids of your patients?
I do not recommend vaccination. I just said that. I do not recommend vaccination at all. So, legally we are bound to give and follow whatever government of India says. That's why we say that just give that much, whatever is legally bound. Nothing else is to be given.
Okay,
Now,
ma'am.
doctor,
Thank
I
you
just
so much.
wanted to ask you now that IVF case four failed and the fifth, the child was got and the father became distanced himself.
Yeah.
So,
Hmm.
there does the family dynamics, do you put this role of counseling so that to make them a cohesive family unit?
Yes, yes. So that's a very big case, and that child stayed with me for treatment. So that was one of the case in ADHD course. Okay, because that child stayed with me for almost 8 years. We treated the child, we treated the mother also, and eventually father also started coming to me for treatment. So typically, what happens is you first give result to the child. The minute you give result to the child, the whole family. So if you want to improve any situation, you remove the problem out. The minute you remove problem, the situation becomes better. So the minute you give result to the child, the family dynamics changes. It is not the same anymore. So you give result to the child, and eventually what happened is the mother had also become very cold. Like she was not a very warm mother. So she came for treatment for of her hypertension. She became all right, and when out of three people, two have improved. You see, naturally the circumstance had completely become better. But then father came for his treatment of vitiligo because there was so much of suppression of his emotions and he had become very, very cold. So a very simple remedy like natramur helped him. And the whole family became a very nice, uh, cohesive again. Definitely, there were a lot of rounds of counseling which happened with mother first, with her coming to the warm mother kind of a state, accepting the child with his ADHD, with father's coldness, all those acceptance that also became. So, Dr. Halvini, I'll tell you, I conduct these workshops for enhancing happiness quotient. Okay. And these programs are based on gratitude. So the group program. So she did couple of rounds of the same program. Same program she attended multiple times because she said, one time when I did it, I got this takeaway. Second time when I did it, I got this takeaway because there was so much negativity which she had in her mind that it took her time. And then there is a program. So recently I published a book, not recently, last year I published a book called as Uplift, wherein I have mentioned this lady's case. Uplift is a program, 3-month program, counseling program, which I take for enhancing happiness quotient of people. So it's a one-on-one program. So this mother did Uplift as well, wherein we did inner child journey. We did a lot of like different modalities of counseling I use in that program. So definitely to give better, bigger, long lasting results, you have to incorporate counseling in your treatment. Yeah. So role of counseling आपने पूछा था, right?
जी.
Yeah. Role of counseling is very, very essential, especially wherever the relationship dynamics is the root cause of illness.
Correct. Yeah. Thank you, doctor.
Thank you so much, ma'am. Thank you so much for such a detailed explanation. So kind of you. So with this, I think we have come to the end of the question and answer session. So I now request Dr. Preeti Kulkarni to deliver the vote of thanks. Dr. Preeti Kulkarni? Dr. Preeti Kulkarni, ma'am? I think there should be some technical issue. Fine, okay. So thank you, everyone. I thank our esteemed speaker, Dr. Vrushali Saraswat, for such an enlightening session, for such a detailed explanation, and that inner journey of the child and mother. Everything was very beautifully explained, ma'am. Thank you so much, ma'am. And I thank Dr. Halvin Koilo, ma'am, for taking so much effort in arranging these sessions, webinar series, and everything. Thank you, ma'am. I thank Dr. Jagati, ma'am, for completely taking part of the technical aspect of the webinar and giving so much support to us. And it went in a smooth, peaceful way. Thank you so much, ma'am. Thank you, everyone, for joining us. Thank you so much for your patient listening and your active participation. So once again, thank you, everyone. With this, we
It was
can
a
end this
great
webinar.
pleasure, and I'm really happy that you guys really engaged very well. Dr. Halvin, thank you so much for inviting me. Thank you.
Wonderful session. Thank you, doctor. All the best.